The CDC is extending the federal mask mandate on planes and public transit for 2 more weeks as COVID cases climb around the country. The decision follows weeks of pressure from airlines, including a last-ditch push yesterday to roll back the mandate. NBC News national correspondent Miguel Almaguer has more.
The 2-week extension of the federal mask mandate on public transportation impacts tens of millions of Americans every day. With the order set to expire next week and now extended into next month, passengers in the air, on the ground, and riding the rails will still need their masks, the CDC citing a rise in new infections.
It isn't like things are static. Things are moving. We're seeing an increase throughout the country.
Often a point of controversy and confrontation. The FAA has received complaints of over 1,100 unruly passengers just this year, more than half related to wearing a mask. After weeks of pressure, airlines lobbied for change.
It's time to let the masks go and let people decide.
Airlines for America urged the CDC to end pre-departure testing for international flights and domestic mask mandates, saying neither restriction is currently supported by data and science.
It's outlived its usefulness at this point. We don't understand why this continues for airlines and does not continue for restaurants, bars, sporting events, take your pick.
With airlines and Americans eager to return to normalcy, the face of travel remains the same for now.
NBC's Miguel Almaguer reporting there for us. Let's bring in former FDA Commissioner Dr. Scott Gottlieb. He's a member of the board of directors at Pfizer. His recent book is entitled Uncontrolled Spread: Why COVID-19 Crushed Us and How We Can Defeat the Next Pandemic. Dr. Gottlieb, good morning. It's good to have you back on the show. What about this decision here? 2 more weeks of wearing masks on airplanes and on public transit. Obviously, the airlines have been lobbying for a long time to get rid of that mask mandate, up until yesterday, in fact, on TV, before that decision was made. Does it make sense to mandate masks on airplanes?
Well, look, at this point, I think we can lift the mandate. I'm not surprised they extended it out a couple of weeks. We're in the setting of a surge of B2 infection right now. It's regionalized. It's mostly in the Northeast and Mid-Atlantic, some parts of Florida. I suspect we're much deeper into that surge than we know, because we're not measuring all the actual infections that are occurring. I suspect we're only capturing 1 in 7 or 1 in 8 infections, because a lot of people are either testing at home or not testing at all. And I think this is going to be over sooner than we think. I think we're much deeper into this surge. So 2 more weeks, things may look much different in terms of the pace of the infection here in the U.S. I think the bigger question is, what do they do after the 2 weeks? And there is some scuttlebutt that they won't lift the mask mandate entirely, but they'll require passengers to wear masks when they come on the planes and when they come off the planes. Now, those are the highest risk points in time, when you're boarding or when you're coming off, because you're congregating without the good air filtration. But I think if they do that, if they try to extend out some partial mask requirement, it's going to be very hard for the airlines to enforce. I think that's going to get a lot of pushback.
What about the point we heard in the piece, which is true? I can go into a crowded New York City restaurant, or I can go to a concert at Madison Square Garden, be right on top of a bunch of other people in an enclosed space without a mask on. So what is unique and different about an airplane?
Yeah, what's unique and different is it's under the federal government's jurisdiction right now, and I think the federal government is having a difficult time peeling back the last real vestige of the mitigation that they imposed. So they pushed it out 2 weeks to sort of wait and see on what happens with the B2 surge. I suspect they're going to lift it after 2 weeks. I don't think that they can push this out again unless the situation dramatically changes. The question is, do they lift it to entirely off? Being in the airplane is safer than being in a confined space in terms of the air quality. The filtration is very good, but it's only good once the engines start and the air is actually moving. So the 2 most dangerous points in time are when you get on and off the plane, when the air filtration isn't on typically. And so if you're someone who's at risk, you can wear a high-quality mask. One-way masking does work, and I think that's where we ought to land, a recommendation to individuals who do feel that they're at risk to wear a mask, a high-quality mask, particularly when they're boarding and getting off, the 2 sort of points where you're crowding together, you don't have the high-quality air filtration system running. But maybe on the whole flight, if you're someone who feels that you're at a higher risk than an ordinary passenger.
You know, Doctor, we had you on last year, and you'd said before the Delta variant, you said now would be a good time to relax some of these guidelines, because if we have a surge, which we did later, then when you tell people that they need to put masks back on, they'll be more willing to follow you. Doesn't this undercut the authority of federal health officials when, again, as Willie said, as a package said, as you said, people go into nightclubs, people go into restaurants, people go into sporting events. They go to places where there actually isn't as much circulation as you have when the engines are on planes, and they don't have to wear masks. But we walk into airports, and immediately, if you don't put a mask on the second you walk through the airport doors, you have people coming up to you, acting like it's March of 2020. It just seems absurd at this point, doesn't it?
Well, look, to a degree, I think what would corrode public trust and the ability to re-implement these things if the situation does change is reimposing them right now. I don't think that there's an indication that we should be reimposing any mitigation, any mask requirements. So, quite frankly, I think what Philadelphia did is more corrosive to the ability to reach back to these kinds of tools later. I think in the case of the airlines, it's a question of when do they take it off. And as long as they're clear that this is really just a 2-week extension and set clear goalposts of how and when they're going to lift this, I don't think it's corrosive. I think the difficulty right now is there's some uncertainty is it really going to come off in 2 weeks? And so if they made a clearer statement that said, look, there's a B2 surge, we think cases are coming down, if in fact they do continue to come down like we expect, we will lift this in 2 weeks, that probably would have been a better statement. They sort of said that, but not quite. I think that probably would have been a better statement. But I don't think this 2-week extension in and of itself is going to undermine their ability to reach back to these tools later.
And let's also talk about where we are now, as opposed to where we were a year ago, where we were 2 years ago. A lot of over 200 million Americans have had two vaccinations. They've had a booster shot. You look at the immunity in the United States. You look at all of the people who have had this, and look at the difference between the United States and, let's say, China, which had a zero COVID tolerance policy. Aren't we in a much, much better place now than we were even a year ago, where our federal officials could say, listen, if you have immune issues, if your kid's young and they haven't been able to get a vaccine, wear a mask. You can do it voluntarily. But for the rest of the population, aren't we at a radically different place we were than even 1 year ago?
Look, you're absolutely right, and you're seeing policymakers shift more of the onus onto the individual to take steps to protect themselves based on their own measure of their risk. You're right, we have a very tall wall of immunity through both vaccination as well as infection. Probably 60% of the public has had Omicron, some Omicron variant at this point. The other thing that we're seeing is that the continued evolution of this virus is continuing to mutate quickly, faster than the fastest flu, which is H3N2. But the continued mutation that we're seeing right now is within this Omicron lineage. So we now see new variants of B2. We see B4 and B5 emerging in South Africa and Botswana. That's actually somewhat reassuring that we haven't seen another Omicron-like event, that the evolution of this virus is within that Omicron lineage, because it means that the genetic mutations that we're seeing are going to be more predictable, and we could formulate vaccines against it.
So I'm just curious about the latest sort of versions of COVID, Doctor. How we're told they're extremely contagious. What does that mean? How long do you have to be exposed to someone? In what capacity to catch it? Does masking prevent that, or would it better to let it sweep through? Because my understanding is people are still dying from this.
Yeah, you're better off not getting COVID. That's the bottom line.
Right.
And especially if you're someone who's vulnerable to it. Look, this is spreading through more of an airborne type of mode of delivery rather than droplet transmission, meaning that it seems to be extending in the air for longer periods of time, for longer distances. It's more measles-like than flu-like in terms of its transmission pattern based on what we've seen. There are 2 new varieties of B2 that are circulating in New York that seem to be slightly more contagious than the B2 that we've seen. And these 2 new variants in South Africa, B4 and B5, have picked up this new mutation, this F486V mutation, that seems to give the virus more ability to defeat the existing vaccines, at least the antibody response induced by the existing vaccines. Now, it's unclear if they're going to spread here. They also have other mutations that might make them less transmissible in terms of their ability to bind to the receptor that these viruses bind to in our upper airway, this ACE2 receptor. So it's unclear just how virulent, how transmissible these are going to be. But this virus is evolving ways to make it slightly more contagious each time we get a new version of this Omicron strain. But again, the fact that the mutation's happening within the Omicron lineage, that's what we thought would be the end game here, that the continued mutation of this virus would occur within one of these lineages. I thought it would be Delta, then Omicron came along, and now the continued mutation does indeed seem to be within Omicron. It probably argues in favor at some point switching over to an Omicron backbone vaccine. As you know, Pfizer and Moderna are working on it. The company I serve on the board of Pfizer. So I think at some point we probably will be switching over to an Omicron backbone vaccine if, in fact, the mutations continue to be within this lineage. And that's what we've seen so far. And it's been about, 5-6 months with this, maybe.
Yeah, and of course, Mika, you were talking about are people still getting sick and dying. They are. The numbers, though, are substantially down for the number of people who are dying. So, Doctor, you're still, again, on the Pfizer board, so we're just telling people that. Before I read this breaking news from the Wall Street Journal that just came, you alluded to it, but Wall Street Journal breaking news just broke. Pfizer says its COVID-19 booster generated a strong immune response against Omicron in children ages 5 to 11 in a late-stage study. Obviously, a lot of parents will take great relief from that breaking news from the Wall Street Journal. What can you tell us?
Well, look, the vaccine, as you know, is authorized as a 3-dose vaccine for adults. It's authorized for 12 to 17 now. And this was looking at 5 to 11. This was a study looking at the third dose delivered to children ages 5 to 11 to make sure the vaccine is safe and effective and is going to induce an additional antibody response that's going to provide clinical value. There are children 5 to 11 right now that, based on CDC recommendations, are getting a third dose of vaccine. They're children who have pre-existing health conditions, who are immunocompromised. This data would support a filing by Pfizer for general availability of a third dose for 5 to 11-year-olds for parents who want to get their kids boosted. And in fact, Pfizer is going to be filing with the FDA for authorization for that third dose based on this data.
All right. Former FDA Commissioner Scott Gottlieb, thank you so much for being on this morning.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.